Okay, so in this last lecture for this module, I wanted to talk about the use of contingent social or environmental reinforcement for abstinence. Um, and the reason for this is because, as I mentioned in one of the questions, use of prize-based or monetary-based incentives to promote abstinence is considered pretty controversial. And so it's important for us to try and consider alternatives that might be more acceptable both to the treatment community and the general public. So I personally have seen the value of using social reinforcement. And before I get into sort of more specific research on this, I wanted to mention that I do believe that the therapist is a form of social reinforcement. So your behavior with respect to your client in terms of being warm and welcoming, shaking their hand, thanking them for coming in, reinforcing them for the effort that they're putting in. All of these things can be really powerfully reinforcing to clients and help to promote abstinence. And I always love to tell the story about a client that we had who was in a contingency management program and unfortunately could never submit a negative urine specimen in order to take advantage of the monetary based incentives that were available to him. However, he would come and he would spend all day long in the clinic claiming he couldn't leave a urine specimen. And during that time, he would interact with all of the clients that were in the waiting room and he'd interact with all the staff who would come out. And so we sat down and did a case conference with the therapist and asked the therapist about this client. And it turned out that the client had um, no support network. So, in addition to the fact that he had no drug free support network, the people that he was using with were very hard on him. So, he would not get any kind of support there either. In fact, he got beat up quite a bit. And so, what we came to understand was that he spent a lot of time in the clinic because he found being in the clinic socially reinforcing. So we decided that we would try to capitalize on his motivation to receive social reinforcement by linking it to him submitting a urine specimen that was drug negative. So what we told him was that from now on, he could only spend time in the clinic for his sessions. So he would come, he would see his therapist, and then he would leave, and he couldn't hang out in the clinic anymore. However, and he didn't have to leave a specimen. So usually they had to leave a specimen, but if he knew he was going to be drug positive, he didn't need to try and leave a specimen. However, if he were able to achieve abstinence, he could tell us that he was ready to leave a specimen. We would do a quick test on site, and if he tested negative, he could spend as much time in the clinic as he wanted to. And so over a period of a couple of weeks, nothing happened. He came in, he saw his therapist for 30 minutes or so, and then would leave. And then one day came in and told us that he was ready to leave a specimen. Now, in the interim, we talked to all the staff and explained that what we were doing, that basically when he came in and gave us a negative specimen, that the staff should all reinforce him, tell him what a great job he had done, how happy we were to have him be in the clinic for an extended period of time. And so when he did ultimately provide us with a negative specimen, we were able to do that. The staff, every member of the staff came out and congratulated him, told him how happy we were and how proud of him we were. He got to spend a ton of time interacting with clients in the waiting area, got to spend as much time with his therapist as he wanted. And what was remarkable about this was that it was sufficient to get him to achieve the first 2 weeks of abstinence he'd ever had. Now, some might argue 2 weeks, that's not long enough. But for this guy, he had never had 2 weeks of abstinence. That was the longest period of abstinence he'd ever had. And so he was able to kind of finally sample other forms of reinforcement that could potentially compete with his drug use. And so what we thought about this was that this is great, right? So we could kind of identify what was something that was so valuable to him that it would compete with his desire to use drugs. Of course, the problem with social reinforcement of that nature is it's hard to maintain, and of course, clients satiate on it. But it does sort of highlight the importance and value of using these non-monetary based reinforcements for those clients for whom social reinforcement is really valuable. So Kind of thinking along those lines, and also kind of responding to the sort of resistance that people have to these monetary-based approaches, a couple of researchers have come up with alternatives. And so the first were these work therapy programs. And these were really brilliant ideas. The idea was that rather than tying money to abstinence, they tie the opportunity to work and earn money to abstinence. And you can kind of imagine that since all of us have to work to earn our money, that this might be something that would be considered far more acceptable and far less controversial as a way of motivating abstinence. And so there were two, Ken Silverman, who's at Johns Hopkins, and then Jesse Milby, who is in Alabama. Ken Silverman developed what he called the therapeutic workplace. Essentially, what he did was he started a nonprofit data entry business, and he, quote unquote, hired opioid addicted pregnant women to work in this business. And so what he did was he trained these women to enter data. As part of this data entry business, they got business from researchers all over Baltimore. But the women could only work and earn money in a given day if they arrived and submitted a drug negative urine specimen. And Ken did quite a bit of research on this. And one of the studies he did was basically a comparison of abstinence contingent versus abstinence non-contingent access to work. So in the abstinence contingent group, women would show up, and if they submitted a drug negative urine specimen, they were allowed to work that day. In the control group, which was the abstinence non-contingent group, they were yoked to a specific individual in the abstinence contingent group, and those women were allowed to work regardless of the result of their urine test, based on whether the person with whom the participant with whom they were yoked could work or not. So they got to work on some days when they were drug positive. They didn't get to work on some days when they were positive or negative, right? So their access to work was not contingent upon their drug use. And what they found was that rates of abstinence were considerably higher if access to work and therefore access to pay was tied directly to submitting a drug negative urine specimen than if it were not dependent on submitting a drug negative urine specimen. So really support for the idea that access to work can be highly motivating, especially for these opioid addicted pregnant women. So again, this is the kind of idea that could have some traction, right? People might be more willing to put tax dollars towards this, especially if a workplace could be set up in such a manner as to encourage and support abstinence in this way. The other approach was this guy in Alabama, Jesse Milby. And he argued that there were really two barriers to successful recovery. One was lack of adequate housing, and the other was lack of opportunities to work. And so a lot of patients in substance use treatment will mention the fact that they have difficulty finding work because people don't want to hire someone who has major gaps in their work history, or who've been incarcerated or whatever. And so this can be a really significant challenge. So what he did was he developed a construction company called Bad Boy Builders. And the men were allowed to be trained to work and then ultimately work a construction job if they were drug negative. But perhaps more importantly, once they built this low income housing and they had sustained abstinence for a period of time, they were actually invited to live in one of the buildings that they had helped to build. So think about that for a second, the level of pride that one might have in not only learning a skill such as construction, which is highly marketable, but then being able to actually live in an apartment that they had been instrumentally involved in building. Again, a really highly effective approach. And then finally, I wanted to mention the community reinforcement approach. It's mentioned in your textbook as sort of an adjunct to these prize-based or incentive-based approaches, but CRA, or community reinforcement approach, is a highly effective intervention in its own right. So this approach involves structuring the environment in such a way that it supports and or reinforces abstinence. The idea is to increase the client's involvement in activities that are supportive of and also interfere with use. So that would involve things like work, recreational activities, and social activities. And so CRA was CBT based, so clients would come in and they would meet with a therapist on a weekly basis and they would get skills training and other CBT oriented treatment. But in addition to that, there were other groups and supports that they were taught. So there was an abstinence contingent social club that clients were allowed to participate in if they had maintained abstinence for the preceding week. This would involve having all of the clients who met the criteria of abstinence for that week come in. They would get to have pizza and socialize with other abstinent patients. And then there was this sort of acknowledgement of their accomplishments, how long they had been able to sustain abstinence. So there was this really great social component. We actually did this in Baltimore when I was a postdoc at Hopkins, and I recall a patient coming up to me saying, "Hey, can you please let everyone know the reason I'm not at social club this week is not because I was using, but because I have a doctor's appointment scheduled at this time." So that social acknowledgement was really an important piece in helping clients to maintain their abstinence, or at least encourage abstinence. They also had a job club, and job club was a period of time that would help clients with all of the steps involved in finding and securing a job. So this would include things like resume building, interview skills, uh, um, what are the appropriate clothes? When I was up in Vermont, sort of visiting Steve Higgins' lab, where this has sort of been perfected, they were having a patient come in doing a mock job interview. So the client patient was told to dress in this clothes that he was going to wear when he went on his interview. Every single staff member was informed that the client was going to be coming in to do a mock interview. So he was treated as if he were at a job interview by the secretary, by everybody else in the building. He was interviewed by a staff member that he didn't know, and then the staff member who did the interview and the therapist all met to give the client some feedback about how he had performed. And the idea being to increase the likelihood that the client is going to perform the best way possible in these interviews and increase their likelihood of getting a job. So again, providing this, and also in addition to that, they would have access to computers, they would have access to the heavyweight paper that was useful for putting resumes on. So all of these things were really critical to helping the client in getting a job. And then the final piece was the sort of recreational counseling. So helping the clients to identify activities that either they had at one point in time found reinforcing or things that they wanted to try out. And then the vouchers that they would earn in addition to this could be used to pay for things like greens fees at a golf resort or movie tickets or something that would be consistent with a drug-free lifestyle. So this approach is highly effective even without the voucher piece, obviously more so with the monetary incentive. So at least in one study by Steve Higgins and his colleagues, the mean weeks of cocaine abstinence just using CRA without the incentives was 6 weeks. Whereas that nearly doubled, so it was almost 12 weeks when the monetary incentives were added. So all of this to say that social reinforcement and environmental reinforcement can be really powerful if it's used properly and contingently. And so it behooves us to start thinking about how we might be able to make use of environmental contingencies to help facilitate and promote abstinence among patients who are trying to attempt recovery.